Good morning, everyone. I'm Murray Ross with the Kaiser Permanente Institute for Health Policy, and I'm pleased to be back here for, I don't know, the umpteenth time. Thank you to Paul, thank you to Margaret, and thank you to Merage for having me here. I appreciate it. Jim Glassman said something about not knowing what we'd be talking about back in November prior to the election. And I have to say that's less true in the health policy side. We knew what we would be talking about, but we didn't know how we would be talking about it. Today marks 6 years and 11 months to the day since the signing of the Affordable Care Act. We've had 2 presidential elections, 4 total elections. I don't know, Wendell, you have a better count on this, 60+ votes to repeal the law in the House. It's safe to say that this is a piece of policy that has both very high favorables and very high negatives. But now we seem to be on the cusp of some significant change. And we have an absolutely wonderful panel to explore the what, why, and how of repeal, replace, repair, rebrand, reshuffle, whatever it is that's going to come out of this, this next session of the Congress. You have their biographies in your folder, so I'm not going to belabor them, and I will just introduce each panelist with a sentence in turn, beginning with Wendell Primus, who is the Senior Policy Advisor on Budget and Health Issues to Democratic Leader Nancy Pelosi. Wendell has been a fixture on Capitol Hill for a number of years. How's that? He and I go back 25, but I know it's longer than that, so Wendell.
Well, it is a pleasure to be back. Thank you for inviting me, and I think that first panel was wonderful, and so I can skip some of my talk as a result. I want to begin by thanking Joe Antos and his colleague Jim Capretta. They wrote a little brief that said, repeal and delay is not very wise. And the Republicans seem to have listened, and so now we're into repeal and replace at the same time. So I thank Joe for that. The other thing, I always want to get to know the audience a little bit. I'm going to give you 3 choices. How many of you want to just simply repeal the Affordable Care Act? How many of you want to repeal and replace? And then how many of you want to keep the ACA and maybe strengthen it and improve it a bit? So how many of you are for repealing? Oh, that's great. How many are you for repeal and replace? Some of you. How many are you for keeping the Affordable Care Act and improving it a bit? Okay, well, I can sit down. What I wanted to do today was, well, the next thing I want to say is, while that first panel was going on, John Boehner was tweeting, and he basically said, you know, when I heard they were going to repeal and replace quickly, I laughed. And then he also went on and basically said that the Medicaid expansion is not going to get repealed. And I'm going to explain a little later in the talk about why I think that's true and why I do really believe, my forecast here is Nancy Pelosi and the Democrats, even though we're in the minority, are, I think, going to be able to block a good part of the repeal and replace agenda. The first slide here, I'm going to go quickly through some of these. These first couple slides just set the stage. I think the criteria by which you should judge a health care reform is what happens to the uninsured rate, the affordability, and right now the Republican staff are telling all the groups that come by saying, get used to it. We are not going to keep the 22 million. It is going to be a smaller number. What happens to the quality of coverage, what happens to overall health spending, the improvement in healthcare delivery, impact on federal deficits, et cetera, and the impact on the economy. Just 1 or 2 facts about health spending. I put those up there so that when you have a tax credit of $3,000 or $5,000, whatever it is, compare it to that family amount of spending, $17,000. Also, and this is a big issue in pre-existing conditions, a very small percent of the population spends a huge, and you're a healthcare crowd, you know that, but it's just worth repeating. And then I think the hospital industry, which is working very hard now to keep the Affordable Care Act in place, is federal law requires the hospital industry to treat people that come to the emergency room, and they are not guaranteed payment. They're the only industry in America that has this fact that they have to provide services without necessarily getting payment. And there again is just showing you the skewness of health spending. And thanks to Jim Glassman and Bill Hoagland, I put this slide up because I think it is one of the most important facts right now confronting our society. There was no mention of it in the campaign that we had, and that is, how do we keep those Medicare, Medicaid, and Social Security promises? What does it mean for tax policy, et cetera? And I'm going to come back to that. I also think this chart means we shouldn't be capping Medicaid cost to the states right now, because Medicaid costs are going to go up, and Grover Norquist is still doing his work in Washington, D.C. There is no way that we should be talking about slashing taxes or cutting revenues right now. In fact, it is just the reverse. That slide is just to convince you that, and it's one of the difficulties of why the Republicans are having a hard time figuring out what the replace is. I mean, the truth is, the Affordable Care Act was built on Republican principles, the individual mandate, making sure your hospital bills weren't going to be paid for by someone else. It wasn't a single payer plan, et cetera. So there is a lot of similarities between the Nixon plan, the Dole-Chafee plan that was a response to the Clinton health reform bill, the Romney bill that passed in Massachusetts, and then the Affordable Care Act. This is a slide just, again, I think while we were writing the Affordable Care Act, we scoured the literature, we put a lot of ideas, and I'm planting cost control seeds that I think may have, or at least some of these are going to have an impact on healthcare spending going forward. I mean, HIT, the CMS Center for Innovation, the bundling of payments, the reductions in hospital admissions, et cetera. I'm going to spend just a moment on this slide. I do think the Affordable Care Act has worked, and the fact that so many of you raised your hands seems to me that you agree. So we've had one of our lowest uninsured rates in our nation's history. 22 million people, according to CBO, have gained coverage. And that number would even be bigger if about 19 states had expanded Medicaid and didn't. We have also restrained healthcare cost. Now, Joe and I may differ a little bit. I think it's not all due to the Affordable Care Act. It's not all due to the Affordable Care Act, but I think the Affordable Care Act has definitely helped, and we're at our lowest, the increases at their lowest point in about 50 years. We've also improved healthcare quality. There's fewer hospital readmissions in Medicare, a significant decrease in hospital-acquired conditions, and we've also strengthened the economy. There's what's happened to the share of the population without health insurance. There is real per enrollee spending growth. And look at the Medicare. Now that is clearly due to the ACA. And we did cut or slow down Medicare cost. I want to say that very carefully. We slowed down Medicare costs while improving benefits, and we actually had a negative growth rate in per enrollee. Now, some of that is also due to the fact that Medicare right now is enjoying favorable demographics, more 65, 66-year-olds, which do cost less in the Medicare program than the 85 to 90-year-olds, et cetera. But the point is that we've slowed down that per enrollee spending. Here's what's happened to the growth in real costs for employer-based coverage. There's what's happened to projected national health expenditures. There is the actual premium relative to the counterfactual, the dotted line, is if healthcare costs for employers had continued to go up at the 2000 to 2010 rates, and that's where you get the fact that premiums are $3,600 less. I mean, it is, again, a pre-post comparison. There's what's happened to Medicare spending. We've lengthened the exhaustion rate. We've on the HI, the trust fund, by about 11 years. And we've also reduced the deficit significantly because of the Affordable Care Act. In fact, if you looked at Medicare and Medicaid spending in 2020 as projected by CBO in 2010, and now look at the projection for 2020, it's actually lower even though we've expanded Medicaid and added the subsidies. So healthcare costs have slowed enough, and we didn't even need all those tax increases, if you will. And so what you see here in the reduction in the deficit is primarily because we added, as part of the Affordable Care Act, significant tax increases. There's what's happened again to quality, readmission rates. And then the thing, since I'm in California, the thing I want to emphasize is that California is the shining example here of what the ACA did. We have nearly 1.6 million people enrolled in health coverage. We've had the low premium increases in the covered California. The benchmark plan has grown about 4.1% per year. Now, I realize Arizona, there's several other states where it's increased significantly more, and we can come back to that. There's 11 carriers that are offering coverage here in California. And on the same actuarial basis, in other words, holding the benefits equal, et cetera, the cost in the exchanges is actually 15% than in the large employer plans. That comes from John Burko, the Covered California actuary. So, you know, in my mind then, California is really the shining example of where the Affordable Care Act has worked well. I want to spend a moment, because I think the polling right now is moving in the ACA's favor. The latest poll, 52% favor it, 45% against it. But why? And I think it was because of death panels, that myth, the government takeover of health care, and then this, again, the original number was 500. And we the Democrats, and my boss, Nancy Pelosi, complained a lot about this to the president. He didn't give us air cover on the messaging. And those two, the death panel and those huge cuts in Medicare, and when the elderly heard there were cuts in Medicare, what do you think? Those are cuts in Medicare benefits, not cuts in Medicare cost. And so we never got across. So the factoid, in terms of just the politics here, in 2006, when my boss was elected speaker, and in 2008, the elderly broke even between R's and D's. They were divided equally. In the 2010 election, when we lost the House, lost 63 seats, the elderly voted against us 38 to 59, against Democrats, 38 to 59. And I think it was primarily because of, and you can go to the Kaiser polls at that time, and 30 to 40% of the elderly believed there were death panels. And it was basically this quote from Sarah Palin, you know, seniors and disabled will have to stand in front. And, you know, think about that for a moment. That's outrageous. I mean, I think accusing a Republican of having a death panel. But the truth is, and I had the chance to attend the Democratic retreat and heard an MIT professor, those myths, those lies are very sticky. I mean, it is very hard to change the public's opinion about them once they're there. The next thing I want to talk about just a minute, the ACA was not perfect. I can go back and say, oh, I wish we had done permanent reinsurance. I wish we had subsidized further up the income. There's several things that, with the benefit of hindsight, we would have done differently. But clearly, and I put in red here, California avoided these problems. And as a result, I think that's one of the reasons ACA is such a success in this state compared to other states. Healthcare.gov was not ready. The Keep Your Plan promise, which in some states split the risk pool, and the insurance companies came in and said, you know, they had assumed we weren't going to do that. And just before we rolled out, just before 2014, lots of states split that risk pool, and it had great implications for what happened to premiums then the next year in 2015 and 16. We didn't keep our risk corridor payments that we had promised to the insurers, and we had data matching problems. And I do not think we rolled this out in a very friendly way. And how do I think we know we have data matching problems? In the federal exchanges from the beginning of the year to the end of the year, you lost 16%. And it was because we had a lot of unhelpful notices back to people saying, you know, prove to us that your guess of income was correct. Well, how do you prove that your estimate, and remember, these are small businessmen, farmers, et cetera, it is hard to project their income at the beginning of the year. And in the federal exchanges, there was that 16% loss. In the state exchanges, on average, there was a 6% loss. So I think we lost almost 1 million individuals because of that problem. And then we have another problem that still persists today, and it's going to take legislation. We have some ESRD people, and they cost lots of money. They're eligible for Medicaid or Medicare, and the ESRD providers get more money from the exchange plans. So they're actually putting them on the exchange when they should either be on Medicaid or Medicare. So I'm just saying, you know, we have a few things to do. The ACA actually worked better in some instances. I put this up, this chart here shows the subsidy. And my point here is, if you look at that couple, 62 and 60, they have a subsidy of $17,000 just before they lose eligibility. So someone at 401% basically gets a 0% subsidy. That needs to be redesigned. I'm going to skip that chart. This just shows you that I think the Trump administration thus far has created lots of uncertainty, and that is going to be a big problem going forward. And as a result, if you just repeal and delay, you're basically destroying the non-group market, plus you're losing the Medicaid. So just repeal means we're going to have 32 million more uninsured in this country, and the premiums are going to go up, are going to double. I'm going to come back to that. What do the Republicans need to do for market stability? Basically, they need to enforce the individual mandate. They need to ensure plans that cost sharing is going to be there. They need to get these Medicare and Medicaid eligible people off the exchange. They need to assure that the advertising will be done. They got to provide certainty, and we ought to have permanent reinsurance. I'm going to spend a moment on this slide. This, in the leader's mind, is the key issue that's going to keep the Republicans fractured. In the House, there are 50 very conservative Republicans. What they want is basically repeal and the skinniest of replace plans. On the other hand, there are about 50 moderate Tuesday group that's led by Charlie Dent from Pennsylvania, and they are very, very nervous. And in California, I know there are some Central Valley Republicans that actually have the highest Medicaid number in their district that are also very nervous. So I think this issue is going to keep Ryan has a very tough job, the Speaker, to try to get this group of 50 and this group of 50 to agree. And I think at the end of the day, we're going to keep the Medicaid expansion. And I hope we can avoid the per capita caps, et cetera. And I think the last reason, well, the reasons here is spending per capita in the Medicaid program is well below that of Medicare and private insurance. And right now, again, because of that demographics you heard from Bill and Jim, we should not be capping Medicaid dollars. State spending on Medicaid has to go up. I would argue, and I will come back to this in Q&A, that the Republican repeal plans go up. They're going to significantly increase the uninsured rate. There are massive, massive tax increases for the rich, primarily because of wage tax we leveled on people above $250,000 for a family, and the net investment tax, 3.8% on investment income above $250,000. That will mean a cut in taxes of $50,000 for those families making over $1 million. And it's clearly going to cause the poor and the middle class to pay more in premiums and cost sharing. I want to go back to this slide for just a minute. If you look at the ACA design, I think it works well. To make competition work, you've got to have it regulated. You've got to have a similar essential benefit structure. Now we have platinum, gold, silver, bronze, but within that, the consumer has got to know what they're getting. We had insurance reforms, guaranteed renewability, guaranteed, no one could take it away because of pre-existing conditions, et cetera. I would argue that the Republican concepts here are let the consumer beware. And there's no way the structure of subsidies, having a flat income tax credit, and right now that Freedom Caucus is even arguing of whether it should be refundable, let alone advanceable and refundable. So anybody, I think, if just thinks about this for a little bit, if you have $30,000 as a family in the individual market, or $150,000, that family making $30,000 is going to require a higher subsidy than the family making $150,000. And another thing of the design is the extra cost. In other words, if healthcare costs go up a lot, it's the government that pays. That's because the subsidy is targeted to the second lowest silver plan. So if that second silver plan goes up, the subsidy automatically increases. And as a result, that's why I'm saying the extra cost there is borne by government versus the family. I think the ACA, just looking at its design, is much better structured than anything right now that the Republicans have put on the table. We also have a few other things that we need to do this year. CHIP reauthorization, we've got to reauthorize FDA user fees. Puerto Rico has a particular problem. And so, in conclusion, I'm trying to make Murray very happy here. The ACA is working, and yes, it can be improved. California is the ACA success story, and the Republican plans are a big step backwards. But if you think about it just for a moment, look at, again, from 2009, it's just an unbelievable story. I've lived that. So one party, the Democrats, really took many of the principles of the other party, enacted major reforms, and I would say the evidence is clear that it worked. The other party is still calling it a complete disaster and has invested millions, between the groups, et cetera, trying to prove that it doesn't work. The lies surrounding the Affordable Care Act are really overwhelming. And the other parties, Romney's, presidential nominee, think about this. He had a success story in Massachusetts. Massachusetts was the state with the lowest uninsured rate. And yet he basically had to disown that in the 2012 campaign. Now that we're engaged in this major battle again over the ACA, when we really, all that is needed is some minor tweaks to strengthen it. So that's why I think this whole story is really unbelievable, and I'm so glad that so many of you raised your hand and said we need to keep it and improve it. Thank you very much.